The NTRK inhibitors are really a kind of class of molecules that target the NTRK receptor, or the consequence of a fusion of TRK, the NTRK genes, 1, 2, and 3, with other fusion genes that lead to a protein that ultimately leads to what's called constitutive activation of that pathway, leading to kind of uncontrolled growth of a specific cancer. To date, we don't fully know all of the prevalence of the different types of NTRK fusions. In solid tumors, there's both NTRK 1, 2, and 3, and to date, we've seen them appear with many different multiple partners. There is not clearly a specific fusion associated with one specific type of tumor, but in general, they can occur in really two patient populations: relatively rare subsets of tumors, such as secretory breast, such as masked tumors, which are called medullary-acidic cell secretory carcinomas of the salivary, and infantile fibrosarcomas, which are also rare pediatric tumors. But they have been identified in very common tumors like lung cancer, such as thyroid cancers, and even in colorectal cancers. Probably the most advanced in development right now is larotrectinib, which an NDA I think has been now filed. And it's anticipated that we will hear from the FDA very soon whether or not that will be approved in NTRK fusion patients across all different histologies. And this would be really the second tumor-agnostic approval after pembrolizumab in MSI tumors. The other drug that is probably just behind that is entrectinib, which is a little bit more dirty kinase in the sense that it also targets ALK and is less specific, but also targets NTRKs, the NTRK fusion proteins. And that is also looking to get an approval in NTRK fusion positive patients. There are other drugs that are less so known, but are in development. There's a Daiichi compound. I think there's a Plexicon compound also. And there are drugs such as Mirati's stiratinib, which, although the NTRK is not the primary target, it does seem to target NTRK, and there are other targets associated with it. What's known is that other drugs such as crizotinib, cabozantinib also have some off-target inhibition of NTRK, but I don't think, as that I know of in publication, anybody's really reported clinical data on inhibition of those drugs in NTRK fusion positive patients.
What's really going to guide prescription of these drugs is the clinical evidence base that they generate. We've seen with larotrectinib, with the first 55 patients, the pivotal data set, a very striking degree of activity, and I think that supports its use in any TRK fusion positive cancer. We've yet to see a similar data set from the entrectinib molecule. So for now, I think physicians are going to be prescribing these drugs based on their regulatory approval and also the data sets that have been presented publicly.